Well, hi everyone, I'm Judy Elliott, and coming up today on Lifestyles for Women, about 600,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths. It's the leading cause of death in both men and women in America. February is Heart Health, and today we're going to be talking with us Dr. Dr Olson from Hamilton Cardiology Associates. Stay with us as we talk about the signs and symptoms of heart disease. This and much more coming up today on Lifestyles for Women. We'll be right back. Well, hi everyone, I'm Judy Elliott and welcome again to Lifestyles for Women. Today we have with us Dr. Dr Olson, and Dr. Olson is with Hamilton Cardiology Associates, and certainly Dr. Olson, it's a pleasure to have you here today.
Thank you. Thanks for inviting me.
We know February is considered Heart Health Month, and definitely we wanted to bring you in and talk with you about some of the things that are happening with heart and with the symptoms and risks. A lot of times people don't really realize, you know, some of the signs and symptoms of heart disease or heart attack. What are the risk factors when you talk about heart? What are the risk factors for heart disease?
Well, there are some risk factors that we can do something about, and there are some that we can't. So I like to divide it up into those that we can change and those that are still part of our risk factors, but we can't. For instance, the ones that are what we call non-modifiable are like men, male gender. Men tend to have more heart disease at a younger age. So in your younger and middle-aged years, men have a higher risk. When ladies get past menopause, they begin to catch up. So you can't do much about that. You know, your family history. If you have a strong family history of heart disease, especially if before age 50, then you are at increased risk. You know, we can't change our parents. We don't want to, but a lot of times we do inherit these tendencies. There are certain other diseases that increase our risk of heart disease, and a lot of these are not something we brought on ourselves, or at least we don't think so. For instance, diabetes. It is somewhat, diabetes type 2 is sometimes attributable to diet and obesity, but you know, we still can inherit the tendency to have diabetes. Then there are chronic kidney disease. People that have renal insufficiency are at increased risk of heart attacks and strokes. And other diseases too, like rheumatoid arthritis, psoriasis, and HIV. All of these diseases put us at increased risk for heart disease. We think some of the diseases like arthritis increase the inflammation in our blood, which seems to make the vessels more vulnerable to developing plaque. And so those are some of the things that we can't do much about as far as reducing our risk, but then there are a lot of risk factors that are preventable or at least treatable. Certainly, you know, high cholesterol, high blood pressure, overweight, being obese increases our risk. Sedentary lifestyle, smoking is a huge thing, you know, or tobacco use, even not, smokeless tobacco. So these are most of the risk factors that we think about when we talk about risk of heart disease. Right,
and I know that you know, you mentioned blood pressure as well. What are some of the good measurements? You know, sometimes it gets confusing. You try to remember what's the guideline, what should I be looking at if you're trying to monitor your own blood pressure, maybe even at home. What would you say is a good thing, average to look for?
Okay, well, obviously, you know, 120/80 is what we all think of as the normal or the ideal blood pressure. But as we age, it's normal for our blood pressure to go up somewhat, especially the upper number called the systolic number. So we expect that to go up a little bit. So as we get into our 50s, 60s, 70s, and 80s, it's felt to be okay for that number to go up, maybe into the to the 140 range even, or maybe even the 150 range as we get on up in our 70s and 80s. It is a little bit of a controversy right now. One group of experts came out about a year ago with guidelines that actually allowed it to be okay to go up to 160 in people in systolic range between the older than age 60. It turns out the American Heart Association doesn't really agree with that, and they still feel like it shouldn't go above 150, at least until you're at least 80 years old. And then they might agree with letting it go up to 160.
Right.
So, but in the ballpark, we really like it, in the 130s or 140s or less on that upper number for middle-aged adults or older adults.
Right. And what about the bottom number?
The bottom number. It is important too. Probably not quite as important as the upper number. We used to think the reverse when I was in medical school. But it is important, and probably it's really the average or mean blood pressure over time that is the real important thing, but you can't really measure that with a blood pressure cuff, so we talk about the upper number, the lower number. We don't like the lower number to go over 90. We really prefer 85 or less. And the American Heart Association talks about different stages or degrees of high blood pressure. They talk about pre-hypertension in the 120 to 140 range over the 80 to 90 range, and then stage 1 hypertension is from 140 to 160 range. And then stage 2 is above 160 over 100, and then over 180 over 110 is considered like an emergency.
Right.
To be urgently treated.
Right. Would you suggest maybe if we have, if we think we're maybe running a high blood pressure, maybe try to monitor it at home for a week or two, just to kind of see where we are?
Absolutely. And realize that everybody's blood pressure changes minute by minute during the day. And things you do change. Coffee will make it go up for a little bit. Exercise will make it go up for a little bit, but then it'll come back down. And so if you take your blood pressure and it's a little higher than you think it should be, rest for a few minutes and relax and take it again. Even in the doctor's office, really, a lot of times we'll check it when you come in, and then it's high, and then we recheck it in a few minutes and it'll be back down. So it takes several measurements and sort of average it.
Right. Sometimes you're right. Sometimes if you get stressed or whatever, it could change it.
It can.
Real quickly.
And it's meant to be measured after you've been sitting quietly for about 5 minutes at least.
Relaxed.
Relaxed.
Yeah.
With your arm sort of supported.
Right.
Measured at the heart level.
Right.
There's a lot of little, but basically, you usually get a pretty good ballpark figure even from the little blood pressure cuffs you buy at the drugstore.
Good. That's good to know. Well, we're going to take a break right here.
Okay.
But when we come back, we want you to stay with us. We'll be covering more with Dr. Gary Olson with Hamilton Cardiology Associates, and we'll be right back in just a moment. Thanks for joining us back here on Lifestyles for Women. As we continue our show today, we're talking with Dr. Gary Olson with Hamilton Cardiology Associates. And certainly, again, Dr. Olson, it's a pleasure to have you here. And we appreciate you taking time out of your schedule to be with us today.
Well, thanks for having me.
We were talking a little bit earlier, even maybe on the break, I'm not quite sure, but with women being, this is Lifestyles for Women, a women's show, what do you think, or are there any statistics that show that women have more heart attacks than men?
Okay. As most people know, men are at a little higher risk, especially when they're in their younger or middle-aged years. As women get to menopause and beyond, they begin to catch up in their risk for heart attacks and strokes. In fact, over the last 20 or so years, there have been more deaths every year from cardiovascular disease in women than men. But partly that's because there are more older women still living than men. They live longer, and so because of that, the total number of deaths are a little more in women than men. But the individual risk is still a little bit higher for a man than a woman at each age. But certainly women are at risk for heart disease, and it's the #1 killer.
Right, and I think we talked a little bit about that earlier. A lot of people think that maybe, breast cancer, because we hear a lot about breast cancer, is #1, but it really is not. It is heart.
Yes. In fact,
disease.
cardiovascular disease, and that really includes heart attacks, strokes, congestive heart failure, aneurysms, all of those things, actually kills more women every year than all types of cancer combined.
Very interesting, very interesting. Would you know if you had heart disease?
Well, you might not. Certainly it can be silent for a long time until you have an event, a heart attack or a stroke, or develop congestive heart failure, have an arrhythmia, which is a rhythm disorder of your heart. So it can be rather silent sometimes, we all hear about unfortunate happenings of someone we thought was healthy and suddenly they've either had a heart attack or even worse have died. So it can be silent. So you really have to be checked regularly and know your risk factors and know the heart attack signs and symptoms, so that you can, be aware and be preventive too,
Exactly.
Blood pressure, often you don't know you have high blood pressure by how you feel. You have to measure it. And so it should be checked, fairly regularly and treated.
You talk about the knowing the signs or knowing the risks or signs, let's say signs or symptoms of a heart attack. What are the things that you would recognize or try to recognize if something was happening to you?
Right. Well, the most common symptom or sign of a heart attack is chest discomfort. And a lot of times it's not described by the patient as pain. They'll say, I have a pressure here or a weight here. Or an ache. They may clench their fist right there. So it's not a little sharp, sticky pain. It's more of a heaviness or a feeling of, just a bad feeling there. So, and it usually lasts a few minutes. It's not like one of those little pains that hits and shoots through. Those are usually not your heart. Because a lot of times patients will ask me, I get this little sharp shooting pain. I said, well, relax, that's not your heart. So chest pain or discomfort is the most common symptom, but it's not the only one. There are others. And the pain or discomfort can be in either or both arms, can be in the neck or the jaw, it can be in the back, or it can be in the upper abdomen. There's other symptoms too, like shortness of breath, sort of out of, you say you're not doing anything strenuous, but all of a sudden you become short of breath and you don't feel like you should be. That could be a heart attack. It could be other things too, like a blood clot to your lung or something. But it is something to consider. Also nausea or a cold sweat or an extreme feeling of fatigue all of a sudden.
Okay. So those are some of the things that we should be aware of or know that. And I think it was interesting you mentioned back, because you usually don't, or I don't associate a heart, I had a heart attack maybe with the back, but it could be in the back.
It can, and it's usually in the upper mid-back, so it's not like down in your lower back like you hurt when you lift something heavy. It's usually in the upper mid-back if it is due to heart disease.
Very interesting. And I suppose, if you talked a little bit earlier on one of the other segment, heart and family history, to make sure that you discuss that with your doctor so that they know that there is a history related to your heart.
Usually, your physician will ask you about your family history of not only heart disease but other, cancer. There's definitely a genetic component to, we're finding more and more,
Yeah.
most diseases really have at least some genetic predisposition or
Right.
component.
Interesting. What about, do you think a lot of people, well, if you experience some of the things that you were just mentioning, some of the symptoms, what should you do?
Okay.
What should you do, number one?
Okay. Well, first, kind of relax for a second, compose yourself, just very briefly, kind of focus on what you are feeling, and if this is different for you than you've usually experienced. If you experience these symptoms and they're intense enough to really get your attention, then you should call 911.
Immediately.
Immediately. The new American Heart Association guidelines say you should not wait more than 5 minutes.
Really?
Yeah.
And that's pretty short
That's
period.
pretty quick. And
Yeah.
I mean, even if you think it might be indigestion or heartburn or
Don't take a
something you
chance.
just ate, don't take a chance.
Right.
If it's really an unusual thing for you to feel that, then call 911.
Right. Right. Because, a lot of people think they can get in the car and drive themselves to the hospital, which I can't understand, but that is very much a no, right?
That's correct.
Or a family member, you really don't need to be doing
No, it's a lot of times bad things happen when people try to get themselves to the hospital when they're having a heart attack. They may suffer a sudden cardiac arrest en route, and there's just not much that can be
Right.
done, at that point until they get to the hospital. Where if you're the ambulance paramedics, they can stabilize you. They have defibrillators. They could shock you if they needed to en route. They can
Save
have
your life.
Save your life. Have an IV already in, give you life-saving medication.
Right. So don't waste time.
Don't waste time and call 911.
Well, I'm going to take a break here, but when we come back, I want to talk also about some of the things that are happening at Hamilton Medical Center, and the fact that how well they're prepared for patients who come in who are experiencing heart attacks or heart disease. So certainly I want you to stay with us on that as well. So, and you stay with us here on Lifestyles for Women as we continue talking with Dr. Gary Olson with Hamilton Cardiology Associates, and we'll be right back with you in just a moment. We're glad you're back with us here on Lifestyles for Women as we continue today. We're visiting with Dr. Gary Olson with Hamilton Cardiology Associates. Dr. Olson, I know that we are definitely learning a lot from your interview today. We appreciate that, but we don't have a lot of time left in this particular section of our show, but I will ask you, I'd like to ask you a couple things about lifestyle and stress, and how does that relate to the heart problems?
Well, it really is important in terms of your cardiovascular health. In fact, they've estimated, the experts, that up to 50 to 80% of heart attacks and cardiovascular problems are related to lifestyle.
So very important.
Yes.
Exercise, what's your diet?
The diet, vegetables, fruits, nuts,
Right.
those are your friends.
Yeah.
To prevent heart disease.
Always keep those friends, huh?
Yeah, that's right.
All right, now moving on to Hamilton Medical Center and what's happening here in our community and how they are prepared to help with a cardiac arrest. Tell me a little bit about that.
Okay, we're very fortunate. I mean, we have great staff, both physician and support staff at Hamilton Medical Center to treat cardiovascular disease, including heart attacks, strokes, aneurysms, all of those cardiovascular events and catastrophes. We've been very fortunate in the last few years. We have a brand new cardiac cath lab and vascular. We have 2 new cath labs and a new hybrid vascular lab provided in the Mashburn Cardiovascular Pavilion. It's been open about 1.5 years, and it's state of the art.
Right.
We also have a brand new 128 slice CT scanner that's great for cardiac CTs and vascular work. It's good for all other organs scanning too, but very helpful for those cardiac exams. We have 3 new echocardiographic machines.
My goodness.
And we've even been working toward possibly having cardiac MRI capability, which most hospitals this size do not have.
That's wonderful. And recently it voted, what, top 8% in the nation for the cardiac care.
That's right. You know,
exciting.
it was a national survey that looked at mortality, different quality measures, and patient satisfaction. And we were very happy to be in the top 8%.
Definitely proud of that as well.
Yeah.
Thank you so much, Dr. Olson, again for being with us. We certainly have enjoyed your visit
Thank you
here.
for having me.
Thank you. And we thank you for being with us here on Lifestyles for Women. And until next time, I'm Judy Elliott, and we hope you have a great day. We'll see you next time.